in case you don't know me, and I'm going to be talking to you guys about Choice Humanitarian in the region of Peru specifically, and they are partners with GlobeMed at the University of Pennsylvania. So the programs that Choice Humanitarian ran before COVID included family and community gardens. These were used because in some Peruvian villages, there's a great lack of food variety that can cause malnutrition within the community. So these gardens serve to reintroduce variety into the gardens, improving general nutrition, and some of the excess produce is used to generate marginal income and create small businesses. They also set up trout farms in some communities, which serve very similar purposes to the community gardens, except they're more geared towards villages in high altitude areas where growing vegetation is just not feasible and growing gardens of food really is quite difficult. So these trout farms are introduced into villages to generate high quality sources of protein and nutrients, and also to create small businesses for the community. Finally, they also were partnership with Days for Girls program, which really works to increase access to female care and education and eliminate stigmas and barriers through education of young women in the region. And so the impact of COVID on this region, there were actually really high death rates in Peru compared to similar countries, despite really strict government measures for four primary reasons. First of all, they had to keep their markets open because very few families had refrigerators, so they had no means of really storing food for long periods of time. So people had to continuously go out and buy food. And so these markets remained packed and transmission rates were high. Another factor was that there's this informal economy that operates in Peru, which essentially is just unregulated work. It's an unregulated workforce. So these government enforcements were really hard, or these government mandates were really hard to enforce. Additionally, there is a great lack of access to online financial aid in Peru. So when the government in America released our financial package, pretty much everyone got it through their online banking system, but only 38% of adults have bank accounts with digital access in Peru. So to receive this financial aid, many people had to go to real banks where transmission rates skyrocketed, and receiving that physical currency increased transmission rates further. And then finally, the overcrowding in impoverished housing. About 12% of all people or all impoverished people in the country live in overcrowded housing. And we know how essential social distancing is to fighting COVID, and that was essentially non-existent in these overcrowded housings. And finally, we have Choice's response to COVID. So all 2020 expeditions were postponed. What they consider expeditions are very similar to what we consider our grow internships, which is basically in their way of doing it. It's a broad volunteering experience where volunteers get to experience helping communities directly with their feet on the ground. But beyond that, they were able to continue to deliver personal protective equipment to families in times of COVID. This looked like masks, hand sanitizers, antibacterial sprays, and gloves. And they were also able to keep their mental health outreach program operational, which essentially acts as a hotline for people to call to discuss any mental health struggles. And when I read on their Facebook page, it actually also served as a professional development hotline. So it was thankfully able to stay operational and keep people in the community healthy. And finally, they carried out multiple health campaigns. The picture on the slide is actually a picture from a health campaign, which is essentially a daily event at a local community center where nutritional evaluations were conducted on children. Children were screened for anemia, and immunizations were given to community members of all ages.